I'm doing a few things. So the first in my full-time gig is I work at the FDA as a medical officer. So I basically provide clinical consults on submissions from sponsors or from companies regarding devices that they're seeking to get FDA approval for. So that can range from anything typically tailored towards plastic surgery devices, but there's been some general surgery robotics, there's been some vascular surgery devices. So it's a pretty wide array into not only medicine, but also more so the regulatory side of things and how we approve and review these devices that we use every day as surgeons. They have offices everywhere. They're based in Maryland, actually, outside of DC. But the position that I have is remote, and they've been remote since the pandemic. They're just kind of slowly now transitioning back to a hybrid model. But the reason I'm in Tampa is because I have family here, and given the remote nature of the job, was able to kind of move and be closer to them for the year and spend some time closer to them. When I was actually a medical student, I got interested in medical devices. One of my mentors had hooked me up and sent me to this program in France for a couple of weeks. And actually some of the Stanford surgery faculty are affiliated with this institution in France where they do a lot of device work and clinical trials and R&D for surgical devices. On the heels of that, when I was choosing places that I might be interested in for residency, that year of professional development that we have here at Stanford Plastic Surgery was attractive to me for that reason. Specifically, the biodesign program was what I was thinking originally. And I had applied for that. Of course, it's very competitive, but as I was, thinking that might be what I would do, we periodically get emails from our faculty here advising us or alerting us to new opportunities that we might want to pursue for our professional development year. And so this FDA position actually came across my desk through one of those emails, and it sounded interesting. I, reached out to them. And I really wanted to take the year and kind of develop and learn a skill outside of just clinical medicine. And so it's nice that here at Stanford, we have that flexibility where we're not necessarily pushed to do bench or clinical research. And, you can really kind of make the experience your own if you have something unique that you want to pursue. It is a paid position, which is even better. And it is a government position. So it comes with some very nice handy benefits as well. I think that's probably a point of interest for prospective applicants is, when you're thinking about what to do for the year, a lot of concerns arise related to funding and where benefits are going to come from. Typically in the past, the way we've had it set up within the plastic surgery division is if you're doing, something within Stanford and you're still receiving your benefits and your paycheck through Stanford and have funding through there, you typically remain part of the call pool. Is not a huge requirement. It usually averages out to like maybe a weekend a month. So, and nothing during the week. So it's not too substantial. It's definitely nowhere near like being, in clinical, one of the clinical training years. But I wanted to take the year, given that I had never taken any time off previously between college and med school, and really have an immersive experience. So that was kind of one of the things that I was looking for when deciding on opportunities, was making sure it had funding, making sure it had, health insurance and things like that. So basically since July, when the academic year rolled over, I've been pretty much entirely removed from Stanford. All of my pay and benefits and everything come through the FDA and the government. Maybe some anxiousness, but I think other people have done the same. And, I think there'll be maybe a period of a couple of weeks where there's some growing pains and kind of getting back into the swing of things. But everybody says that things come back pretty quickly. So I'm not too worried about it.
You didn't need to like bring a Da Vinci backpack with you to Tampa?
I didn't, but I did. It's nice to have so many great like relationships at Stanford, because one of our medical sales reps actually hooked me up with a cadaver course that was going on here in Tampa. So I was able to do that a couple months ago, which was nice to kind of be back kind of pseudo operating. I would say not necessarily changed, but rather further solidified. After that experience that I had mentioned in France, I previously had never really thought of medical devices as an avenue of, say, research or, something that you could pursue outside of, strictly your clinic hours and operating. But it really opened some doors. And I think the attractive piece is that if you're developing a device or if you're working on the regulatory side, you have a chance to, shape how these devices come to market or potentially even innovate a whole procedure and how it's performed. And in doing so, you then have the opportunity to impact thousands of patients without ever having to directly care for them. And so I think when I think about what I'd like my career to look like, there's only a finite number of people that you can operate on, even if you're the busiest surgeon in the world. And so I think when I look at things like, what impact can I make or what impact can I leave? I think about those things and kind of transcending just being able to operate and just be a clinician. That same mentor that kind of set me on this course and introduced me to the program in France, he would always preach the idea of what he called surgery plus. And so he really wanted his residents at his program to develop not only clinical excellence and clinical expertise while they were doing their training, but he wanted them to leave with an additional skill. Whether that be research, whether that be a master's in engineering that he established, an MPH, an MBA, something else that can set you apart, because just the way healthcare is angling itself, we need our physicians to be able to do more than just care for the patients. And so I think I was able to find a really nice opportunity that gave me a great blend of both professional and kind of personal ambitions for the year, and also is going to leave me with a skill that I've developed now that not many other people have, and in an area that not many people understand, which is kind of the regulatory side of devices. I also started a company earlier in the year, or I guess helped do some consulting for a company that was a startup. And so that was kind of an interesting experience. A lot of lessons learned there. So I did that in addition to the FDA thing. And then I didn't realize, at least prior to this year, how much I valued the interaction with not only the patients, but also just the staff in the hospital, my co-residents, the nurses, the therapists, like everybody that we come in contact with day to day. There's so many interactions that you have, and I didn't realize how much I enjoyed that aspect of the job. And so when I started with the remote work and then moved to Tampa, like I said, I had family down here, but I didn't really know anybody else. And so I quickly found myself, I was like, wow, this is like what everybody was dealing with and struggling with during the pandemic, not being able to leave and not being able to see friends and family. And so I think as healthcare providers, we took that for granted a little bit because our day-to-day didn't necessarily change much. We were still, in our routine and going to the hospital and going to work. But I highlight that just because given the increased flexibility and only working 40 hours a week instead of 80 to 100, I actually took a job as well, doing like a part-time gig working at the front desk at one of the gyms that I go to. And so I bring that up just to highlight that it's been a great year, not only for professional development, but also to kind of take a step back and just, enjoy personal life and getting to see family and making new friendships and things along those lines.